and welcome back to Wellness Chronicles. This is where I simplify diabetes, make those lifestyle changes feel so possible and so real, and help you get healthy one step at a time, one small step at a time. My name is Pooja Patel. I'm a registered nurse and diabetes educator from Toronto, Canada. In today's episode, I thought I would ask the most common question that my patients ask me all the time. How often do I have to check my blood sugar? I know it's really annoying, it hurts, not the best scenario when you have to check your sugar 4 times a day. Now, whether you have been diagnosed with prediabetes or recently diagnosed with diabetes, this episode will help you clarify as to how many times you should actually check your blood sugar, because I know it is really annoying to make those finger pricks all the time. It hurts, it's inconvenient, it's constantly on your mind that you have to do it. So this episode will help clarify and help you understand as to why it's important and how many times to check it throughout the day and what those numbers mean and what to do and how to counteract those numbers and how to deal with those numbers. So let's start with why check your blood sugar at all. Now, checking your blood sugar is like your fuel gauge. It tells you how your body is responding to illness, medications, food, stress, sleep, any of those hormones, any of those patterns that are going to cause a fluctuation in your blood sugars. So it's your fuel gauge to see how well your body is responding to something. What you are trying to do is you are trying to trend patterns. It's not about chasing perfection. It's about spotting those patterns. It's about responding to those triggers appropriately. It's about preventing those highs and lows. It's about making smart decisions every single day to support your long-term health. So let's start with the timings and why it's important to check your blood sugar at those particular times and what that really means for you. So the first blood sugar that I always recommend my patients, and that is also recommended by pretty much every single guideline that's out there, is your fasting blood sugar. So your fasting blood sugar is the first blood sugar that you are checking the first thing in the morning without eating anything, without drinking anything. It's the first blood sugar that you check in the morning. Checking your fasting blood sugar gives you a baseline as to what your blood sugar is. Now, checking your blood sugar at night, just before you go to bed, is a good indicator as to what you might experience overnight. So if you're going to have any highs, if you're going to have any lows, this is dependent on the blood sugar that you check at night. So your 2-hour post-meal sugar allows you to understand whether your meal was balanced or not, or whether something on your plate worked for you or didn't work for you, whether it caused a high or whether maybe it was just not enough. So you should also check your blood sugar before exercising, because this allows you to understand whether you need a snack or not before exercising. So if your blood sugar is running a little bit low, then you might consider having a snack or a pre-workout smoothie or a meal or something like that to be able to make sure that you're not going to end up hitting a low. So just to recap, you check your fasting sugar, you check your sugar just before you go to bed, you check your 2-hour post-meal sugar, and before exercising. Now, having said that though, you don't have to check every single day, every single one of these sugars, but it is recommended that you check your sugar based on the types of medications that you have, the type of diabetes that you have. So this is the golden question of the episode. How often should I check my sugar? So I'm going to differentiate between the different types of diabetes and the patients who are on different types of medications or lifestyle or however they manage their diabetes. And I'm going to tell you accordingly how they should check their sugars. So as a diabetes educator that works mostly with patients who have pre-diabetes and have type 2 diabetes that are managed by lifestyle and diet, with these patients, I generally recommend, I give them 2 options. And the first option is the evidence. And Diabetes Canada suggests that if you are a patient diagnosed with prediabetes or type 2 diabetes and you are managing your condition with lifestyle and nutrition, then you are not required to check your blood sugar routinely on a daily basis. So not once a day, twice a day, anything like that, not routinely. The goal is that you decrease your A1C at the 3-month mark. That's the goal. If you don't know how to decrease it because you don't have the evidence, because you don't know what your triggers are, then you won't be able to implement those changes within those 3 months. And you're at the end of those 3 months, you're still at the starting line. So this is why I recommend my patients to keep a food diary and a glucose diary for 2 weeks, no more than that, just for 2 weeks. And then we go from there. If you are a patient who is diagnosed with type 2 diabetes and are on oral medications, not metformin, but other medications like your secretagogues, incretins, sulfonylureas. These are medications, these are class of medications that are at higher risk for decreasing your blood sugar and causing you to go into a hypo state, which we don't want. So the important piece is, if you are taking any of these medications, then it is recommended that you check your blood sugar 1 to 2 times a day. Again, at random times. It doesn't have to be fasting or 2-hour post meal, at random times. The reason for this is it will help you understand what that medication is doing to your body and whether what you have eaten or whether your meal was enough or not enough, or whether you've had a balanced meal or not. Now, if you are a patient who has type 2 diabetes and actually take insulin, then it is recommended that you check your sugars 3 to 4 times a day. So you check your fasting, you check your sugar before you go to sleep, and you check your sugar before having your meals. So checking your fasting blood sugar is a baseline to see what you're doing is working. Checking your blood sugar at bedtime allows you to understand what your blood sugar will be overnight. So whether you need to have that snack or whether maybe you need to take a little bit of extra insulin. So it helps you plan for an overnight fasting period that you're going to be in. Now the third, which is your before meals, allows you to check to see how much insulin you should take based on the meal that you are going to have. Now, if you have planned a meal that is full of yummy stuff and starches like pasta, pizza, bread, then checking your sugar before the meal allows you to understand as to how much insulin you have to take based on the meal that you're going to have, or based on the amount of carbohydrates that are in your meal. So that determines your insulin to carbohydrate ratio. Pre-meal sugar allows you to understand your insulin to carbohydrate ratio and how much insulin you need to take to cover that particular meal that you're going to have. If you are a patient with type 1 diabetes and you take insulin, then Diabetes Canada recommends that you check your sugar 4 times a day. So your fasting, your nighttime, and your pre-meal sugars, okay? You also should check your sugar before you are driving and exercising. So the reason why you should check your blood sugar before driving is because if your blood sugar is 4 millimoles per liter, then you don't want to get into the car. What you want to do is you want to treat it with 15 grams of sugar or 15 grams of glucose, wait for 1 hour, and only get into a car if it is higher than 5 millimoles per liter. Now, obviously this is for your own safety and for the safety of the others around you while you are driving. So from our conversation today, as you can tell, numbers tell a story. And that is the whole point. We want to hear, see, feel, experience those numbers with evidence and then treat it accordingly. Which is why I always tell my patients, I highly recommend keep a glucose diary and keep a food diary. This is your evidence. These numbers tell a story. These numbers help you connect those missing links and treat with purpose, treat in a timely manner, so that way you're always catching your highs and catching your lows and treating accordingly. So you don't end up symptomatic from a high or a low. And I empathize with those patients who have to check their blood sugar 4 times a day and have to prick their fingers. But these numbers are truly empowering. And I want to make sure that it is quite clear that when you are checking these numbers, that you are not discouraged, you are not demotivated, you are not feeling overwhelmed, especially for those patients who have type 2 diabetes or pre-diabetes, are on metformin, or are using healthy lifestyle behaviors to manage their condition. And the reason why I say that is because you are tracking patterns, not perfection. So one single high or one single low does not define your diabetes journey. It is one day at a time, it is one number at a time. It gives you the evidence, it gives you the knowledge what your trigger is, how to identify that trigger, and how to treat that high or how to treat that low. So this brings me to the pro tip of that episode. If you have been avoiding that meter, don't. Use that meter to empower you. Use that meter for evidence. Start checking those numbers with purpose. Once you start testing with purpose, watch those numbers fall in line. Watch those A1Cs decrease. Watch your insulin resistance get so much better and increase your insulin sensitivity. Watch your energy levels go up, and most importantly, watch that quality of life increase by leaps and bounds. So with that, I wanted to thank you for listening to this episode all the way to the end. I hope you took away some pertinent and important information for yourself or a family member or a friend that you can share with and who might be able to benefit from this information. If you feel like you gained any kind of information from this episode, do not forget to subscribe, share, and comment. This allows me to create more of this content that is evidence-based and share it with you in an easy way, so that way we are creating a happier, healthier community. So until next time, stay happy, healthy, and kind.